Elevator going down. April 1st. April Fool's Day. My lucky day, because I'm a fool. Yeehaw! Yes, I am a fool. I'm full of happiness because today is Friday.
Turn right onto road 136.
Patient direction says, go to the end of the orange trees and make a right. I haven't had this kind of directions in a long time, so I will make a right here at the orange trees.
In 1.7 miles,
Look at this.
turn right onto View Drive.
Come on, a job like this where you get to drive out in the country and sing? Actually, I don't sing. That would be a very sad moment. But anyhow, peace out, Brussels sprouts. All right, so here's the star of the show. No, actually, they're just here to kind of give you a little visual. So let's pretend that this tube here, let's just pretend for a moment that every single person, a tube like this is connected from a source of energy to our back. So during the given day, there's a constant flow of whatever water or energy going from the source to our back, and that's what gets us through day by day. Now, a patient with COVID, some of them, it's been explained to them this way. Just pretend someone's stepping and compressing this tube, smashing it down, compressing it, let's say 80, 75%. That only allows 20 to 25% of energy or flow to go through this tube. Some COVID patients explain it just that way. They know they could do a certain task, whether it be walking up and down the stairs or empty their dishwasher or wash the dishes, but they simply don't have the energy. They say, you know what, it's like 50%, 60%, 80% of my energy is gone. That's just one visual that has helped many COVID patients to have a better understanding of what's going on with their bodies. Really had a fun time speaking to 3 different therapy friends today. The topic was, is there any correlation as far as what we see when treating COVID patients to other diagnoses that we've worked with before? Several of my friends related it to cardiac rehab, a patient after having heart surgery, just the inability to move, just feeling weak, exhausted. Someone related it to pneumonia. Now, that was one of the ones I thought of with the respiratory issue, dealing with pneumonia. And then another friend who spent many years in the hospital, he said it's like someone who is post-critical care, meaning someone who maybe spent 6 to 8 weeks in an ICU hooked up to a ventilator. Well, what does that do to the human body? If a person is in bed and they don't move completely at all, just very small movements, moving their fingers, moving their shoulders, they say for every 1 day that you're in bed, it'll take you 2 to 3 days to gain that strength back. So basically, if you're stuck in bed for 2 months, it can take sometimes 4 to 6 months to get back to that state or that physical condition that you were in prior to going to the hospital. We're going to talk about briefly three levels of care that many COVID patients had to go through. First, being in the hospital, acute. Being in the hospital, acute therapy. So a therapist there would work with a patient. Often, at that point in time, a patient can barely get out of bed. They can barely sit up. Once sitting up, sometimes it would take 2 to 3 therapists just to help that person maintain sitting up on the side of the bed. Working on just general strengthening the legs. Patients often describe it as kind of like how we talked about earlier, this energy level. They knew just 4 months ago that they could do these things. They could, climb the stairs. They could go to the gym. But when they're trying to do these things now, it's just like 90% of their energy is gone. they have nothing left. The next level of care would be like an acute rehab or even like a skilled nursing facility. It's a different building than the hospital. You go and stay there. There's nurses there that tend to your medical needs, and you often work with physical therapists and occupational therapists. You work on a lot of day-to-day skills, dressing, grooming. At this point in time, people can sit up on the side of the bed. Although sitting up on the side of the bed, let's say for 3 to 5 minutes, that sometimes is a full workout. That might be considered a morning workout because of just how strenuous that is on their body. Just imagine that. How many of you have a hard time sitting up on the side of the bed for 3 to 5 minutes? I certainly don't. Then the last level of care. I know we're kind of flying through this, but I don't want to make this video too long. But the last level of care is currently where I'm at. I've actually worked in a hospital setting. I've worked at the acute rehab. I've been managers and directors at both of those locations. But currently right now, I work as a home health physical therapist. And working with some of these patients, a lot of these patients are currently able, once they go home, they're able to walk. They're able to get in and out of bed. But to, let's say, mow the lawn, no, that's not going to happen. To walk down the sidewalk or out their door to get the mail, they do that one day and they're sore and tired for the next several days. So a lot of times at home health, we're just working on building up their activity tolerance, working on exercises, just like cardiovascular activity, hula hoop, jump rope. Those are all cardiovascular activities. We're not teaching patients those. What we're having them do is go on a little bit longer walks, maybe having them like march in place. Some of them have treadmills, and we walk on a treadmill maybe for 5 minutes. All these things to help build up their endurance level. Sorry for the little noise we had there at the end of the previous clip. Our dogs was trying to compete with the neighbor's dog as far as who could be the loudest dogs. I don't know if our dogs won, but they got pretty loud. But anyways, the final phase, home health physical therapy or home health occupational therapy. At this level, a lot of us are focusing on adaptations, helping a patient or family members adjust to the home life. Sometimes finding ways, things that they used to do standing up, sometimes we teach them how to do these things sitting down because of their energy level. At this point in time, some of them may only have 50, 60% of their energy level restored, and they're still waiting for that last 40 or 50%. Just finished working with a lady, worked with her for 2 months, and she was one of the ladies who had a difficult time walking up and down the stairs. But just by having her practice different types of cardio activities, whether it be walking up and down the stairs, a modified distance, or doing like, it's kind of like step variations, kind of like step aerobics would be, but on a smaller scale, that often works well as far as building up someone's cardiovascular ability. Back again, sports fans. Hey, thank you so much for watching. Just wanted to include this section here to see if you have any additional comments or questions. Please submit them in the comment section below. We do frequently read these to find out if there's something else that's a topic of interest for you all. Thank you once again for watching. Please take the time to like and subscribe. This is TUBEular Ohana. Aloha and support from California. Wow. I just received the strangest, weirdest compliment that I've had in a long time. A patient's wife just called and said, "Please know I would never want to be you, but my husband and I love and appreciate you. We don't know how you have the patience to deal with my husband and I.